Good afternoon. My name is Paul Edwards in the Governor's Office. We're grateful that you can join us today for our daily briefing. Today we'll hear from Governor Gary Herbert, and we also have with us today Carlos Braceras, the Executive Director of the Utah Department of Transportation, and Salt Lake City Mayor Erin Mendenhall. And following the briefing from the governor and our guests, we'll have the daily briefing from Dr. Angela Dunn, the Utah State Epidemiologist. Governor Herbert.
Well, thank you, Paul. Let me just make it a little plainer. Again, welcome one and all. Again, we appreciate you taking time with these daily briefings, and particularly those in the media that help transmit the information to the public so that they know what the updated information is and what's going on in the state of Utah. Again, we continue to have challenges out there with the COVID-19 virus. I appreciate the fact that we've developed the most comprehensive plan of any state in America today. We're still in the urgency stage of that, but hopefully transitioning as we go over the next couple of weeks into stability. As I mentioned yesterday, the ability for us to now receive stimulus money from the federal government is going to help our businesses, 90% of which are small business, under 500 employees, actually access capital to help them stabilize their businesses and survive this difficult time and come out, hopefully, at the other end as strong, if not stronger than ever before. I just want to remind everybody that our comprehensive plan, which has 3 phases, urgency, stabilization, and recovery, we're following that plan based on the data, the information we have. Our policy decisions are made on data. It's not based on politics. It's not based on whims. It's based on good data. And I appreciate those in our office and those that are helping us outside, university folks, scientists, medical advisors that are helping us compile data to help us understand the data and then determine what the policies and what our next steps are going to be. With that, I have some concerns I'll just mention today. I've mentioned it before. We have Easter weekend coming up. That's a traditional time for people to vacation. It's a traditional time for spring break for their young people. Warm weather brings people, they want to be outdoors, and that's okay. We just don't want you to congregate in groups. And so we need to be very careful about our travel. Again, our slogan we have is stay safe, stay home. Those directives are still in place statewide. We'd like to have people stay in their regions and recreate there. And there are opportunities for you, in fact, to do that. But again, we would like to make sure that people understand that we want you to only travel if it's essential. Non-essential travel is prohibited. Let me just give you what that means, too. Essential travel does mean you're able to seek emergency services, obtain medications, medical services as you need. That's essential. Essential travel means travel to grocery stores and food opportunities, including delivery and carry-out foods, which we recommend people to do to help support our food industry that are having struggles at this time. It allows you to travel to your workplace if you cannot telework. Again, we hope that all of you are trying to find ways to telework and that your employers are finding ways, innovative new ways to telework and not have to travel, but you're okay to travel to work. It allows you to travel in order to obtain gasoline, supplies required for your work needs from your home, products to help needed to maintain a safe, clean, operable home, business, or vehicle. So there's travel that you can do. Again, our concern is the non-essential travel, and particularly as we come upon this Easter weekend and with this warmer weather enticing all of us to go outdoors. Again, there are places you can go outdoors and enjoy trails and outdoor recreation. We'd like you to do it in the region that you're from, not travel. And I hope that we all have the attitude, I'm part of the solution, not part of the problem. We have some out there that are thinking the rules are okay, but they're for everybody else, but not me. When in fact, it only works if we all do it and obey by the rules we've put in place. So otherwise, stay home, stay safe. I'm also concerned, I mentioned this yesterday, about the economy. Again, I've said in times past, help is on the way, and we've had significant help coming now with from the federal government through our Congress and the executive branch providing monies that are available. So yesterday I shared information about the Small Business Administration and loans that are available. I know that people are taking that to heart. I talked to Zions Bank just this morning. They've had over 17,000 applications in the last 24 hours. So people are getting the message, and there's opportunities out there to get working capital to help sustain the businesses over this rough stretch of road and emerge successful on the other side. So take advantage of those opportunities that we get through the CARES Act. In addition to something new, and that is for those who are unemployed and are on unemployment insurance, the federal government has just boosted your paycheck by $600. That's something you don't have to apply for. It will just happen. Same rules will stay in place for unemployment insurance that they've always done. For those who are just unemployed, the good news is you're going to get more money than maybe what you thought. Additional $600 will help you again weather the storm. If the benefits actually are retroactive for the past 2 weeks, so there's always a 2-week retroactive capability with our unemployment insurance. So if you haven't applied, do apply. We recommend you to apply online. That avoids having to have long waits on the telephone. But go to jobs.utah.gov, jobs.utah.gov, and you'll be able to access the information there and help with unemployment insurance. Last but not least, maybe the important message of the day is we've had a lot of questions about our access to the state from people outside our state, our ports of entry, access points that we have with our roads and through our airport. And so I just want everybody to know that today, in coordination with the Department of Transportation of Utah and with the Airport Authority and Salt Lake City Airport, we are in fact issuing an order requiring individuals, every individual 18 years of age or older who enters Utah as its final destination through the Salt Lake City International Airport to complete a travel declaration form that before exiting the airport. So we're working with the airport personnel and the airlines. This is an order that we will have in place, we hope, by Friday, again for the Easter weekend. And in fact, it's a new thing. We have the technology that allows us to do this, but we're going to ask people, in fact, to report this travel declaration before they exit the airport. And similarly, we're going to require every individual that's 18 years of age and older that comes into our state by automobile or by truck on one of our major roadways to complete a travel declaration form upon arriving at their final destination in Utah. So we've issued that order. Again, we will start this Friday is when this will be implemented. This travel declaration will ask travelers if they've been tested for COVID-19, particularly in the last 14 days, and what the test results are. It will ask whether they are currently experiencing any COVID-19 symptoms, such as cough, shortness of breath, or fever, and to detail where they have traveled before they came to Utah. This will allow us, in fact, to help protect this, stop and slow down the spread of the coronavirus as we find people that come to our area that may, in fact, be carrying the infection. So, again, we appreciate the cooperation of those that this will be involved. This is going to be kind of new technology, and I'm going to let others talk about that in a minute. But like most things, it's brand new. There might be a few glitches as we roll this out, but I expect we'll work through those glitches, and this will be a better way for us to help protect the people of Utah and slow the spread of the coronavirus here in the state. So, again, we appreciate the work of many that's brought us to this point. I think we're in a good place overall for the state. I like the numbers that I'm seeing, and I don't want to declare any kind of a trend, but I think we're in a good place as a state. We want to continue to do what we need to do to have good policy that give us the good outcome that we all desire. So with that, I'm going to invite Carlos Braceras, who's the Executive Director of the Utah Department of Transportation, to explain how this will be done on our destination entry points, and also ask Salt Lake City Mayor Erin Mendenhall to come and talk to us about how we're going to accomplish this at the Salt Lake City Airport. So with that, Carlos and Mayor.
Thank you, Governor. Good afternoon. Carlos Braceras with the Utah Department of Transportation. It's my pleasure to be here today to talk about basically the mechanics of how we're going to execute the governor's order that he's given here today. There's going to be really two efforts that we need to undertake, and I think it's important to first state that we do this with many partners, and I think that's really what we all look to in the state of Utah. Our success is really because we all work together so well, and I think many other states around us look and wonder how we can do the things that we do. And this is really, to be able to combat this is going to take all of us, all Utahns working together towards this common goal of slowing the spread of the virus. So when I say there's two different efforts, there's the entry point at the Salt Lake International Airport, and that's of course owned by Salt Lake City. And Mayor Mendenhall will talk about that and what her vision is for that in a second. And there's the entry points in roadway entry points into the state. And so we've looked at where most of the people enter the state. I'll talk about the roadway portion first. We've identified 9 different locations. There'll be some press materials on the state coronavirus website after this press briefing, where you'll be able to see a map of those entry points. But basically, it's our interstates, so it's I-15 in St. George, it's I-80, both coming into the west and to the east. It's I-15 from Idaho, 84 from Idaho, I-70 from Colorado, 491 coming in by Monticello, and 89 by Kanab. At each of those entry points, we have geo-fenced an area so that cars that are entering the state will receive a text message, and it's going to be coming across what's referred to as the Wireless Emergency Alert System. It's a federal system that they have given us, because of this extraordinary circumstance, the ability to utilize it for the coronavirus efforts. And we'll be sending a text message to all those vehicles entering the state. They will then be asked, once they've stopped driving, they will be asked to then travel to a website. There will be a link there. It's entry.utah.gov. And there will be a self-declaration form that they will be asked to fill out, basically identifying information, name, email address, where they've been in the last 2 weeks, if they're exhibiting any of the virus effects, and any of the folks that are under 18 that are traveling with them. They will then, once they've submitted that form, they will get a received email back confirming that they have in fact done that. And that'll be the entry points coming in by car at the Salt Lake Airport. The visitors that are exiting the airport, there are 2 exit points at the airport currently. Right now, the international exit is closed. We will have folks standing there, and they will be passing cards to those people. Those cards will have QR codes, basically with the same message. It'll be a little more descriptive because we can send only a limited character set over the wireless signal form, and that will ask them to visit the website, so that they can then complete that form. The information will then populate the Department of Health database, and will allow them to use that information in their fight to control the spread. So with that, Governor, I'll turn the time over to Mayor Mendenhall, who's been a tremendous partner in working with the state on this. Mayor? Oh.
Wear it like a bracelet. Thanks for having me here today, Governor and Carlos. This is really a crucial next step for us as a state, and certainly as the capital city, to make sure that we're implementing as many appropriate measures as we can to slow the spread of this highly contagious virus. By all accounts, the Utah data on COVID-19 shows that the measures we've put in place to stay safe and stay home are working. Now we need to keep working together as a state to make sure that we are all staying home and staying safe. Now isn't the time for us to let off the gas. We have to keep moving forward together and evolving quickly with new methods as we are today, as this situation evolves and we learn from others around the country and around the world. Salt Lake City International Airport is one of the largest points of entry to the state of Utah. Normally, before COVID-19, we would see 25,000 passengers a day through the doors at the airport. We're now seeing a fraction of that, but each and every person coming into the state is still an opportunity, a new opportunity for the virus to spread, whether they are residents or visitors. these first steps that we're announcing today will bring us greater assurances as a city and certainly as a state that we are doing what we can to be safe. But these are what I hope only first steps. I understand that UDOT has submitted an order and is awaiting the receipt of no-touch temperature sensors so that we could begin testing or at least temperature checking passengers who are arriving at the Salt Lake City International Airport. They have not arrived yet, and so we're not yet able to do that. But that kind of logistics and strategy, I think, begins to show you how very much we need to work in partnership. Testing, even sensor or symptom checking is not something that the Salt Lake City International Airport can do alone. And so we greatly appreciate the partnership that we have and that has continued between the state and UDOT today. We'll continue to work with the state and UDOT to implement greater levels of health security. And you may have seen in the papers today a discussion about the airport's anticipation of the continuation of the virus impact on the airline industry. Unlike 9/11, where the planes stopped flying for 4 days and dramatic security measures were put in place to give you and I the safety that we could board a plane, we won't see that kind of quick response and ability as people who may be carrying the virus may not even know it yet. And so we will be working and continue to work over probably what will be a good amount of time to implement the type of health security measures that are going to be necessary to keep our economy flowing and keep the state of Utah healthy. Thanks for including me in this today, and we really appreciate the measures that we're beginning to put in place. Thank you, Governor.
Well, thank you, Carlos, and Mayor. Thank you for being here. And again, I think the Mayor illustrates the point that this does take cooperation, all of us working together for the good of the whole. And it's layered, it's methodical. We're adding to things as we learn, again, based on, as I mentioned, good data. I appreciate that the Mayor said that what we've done and what we're doing is working. I think that's the main important part of the message is that what we're doing is working. Some of you may know that I talked to Dr. Fauci this morning, and he gave a positive review of what we're doing in Utah, and very similar to what other states are doing, a little bit different, but getting better outcomes in many other states. So a thumbs up from Dr. Fauci this morning, which I appreciate his positive review of our state's efforts. With that, we'll see if there's any questions that you would like to ask any of us here, the Mayor or myself or Carlos.
Hi, thanks for taking the time. How will the information from the travel declarations be used? Will people be asked to quarantine? Will they be contact traced? Or how will that then, what's the next step there?
We'll hear from Carlos.
Yes, thank you. We take this information very seriously. The information will go into a secure database at the Department of Health. And so if you imagine a scenario where somebody self-identified themselves as exhibiting symptoms of the virus, the Department of Health would then have the ability to contact them to do what we're recommending to all Utahns right now, to quarantine for the 14 days, to self-isolate, and if necessary, to be able to have a testing done for that. So this will allow us the data to be able to manage those folks that are entering our state and to be able to control the virus.
Let me just add, too, that one of the questions that should be asked is, who's going to pay for it? And that's an issue. There's a fiscal note to this. But I believe in talking with the National Governors Association and Secretary Mnuchin here this morning, that we'll have an opportunity to have some federal monies to utilize in this very effort. So again, some of the federal money will help us pay the bills of these extraordinary expenses that we're going to go through to help stop the spread of the coronavirus. Second question.
Hey there, Governor Herbert, when you spoke to Dr. Fauci, could you talk about one thing he said we were doing well, and was there anything he said we had room for improvement on? And will you be making any changes based on the feedback that he provided?
One of the things we talked about is the uniqueness of the different states. He lives on the East Coast, and that's way different, a lot more congested than, say, people here in the Midwest or the Intermountain West. And, you know, the Wasatch Front is congested, but the other parts of Utah are more rural and population. And the need to be able to regionalize, he talked about, was an important aspect he understood and commended. He liked the fact that Utah had got on board early. If you think about when this first came about, you know, we heard about this coronavirus really at the end of December, first part of January. We had our first meetings, in fact, organized our first task force March the 2nd, which was chaired by our Lieutenant Governor Spencer Cox at the time, helping us get a big jump, an early start on what needs to be done. We are early in closing of our schools compared to many other states. We, in fact, closed in-house dining very early compared to other states. I took this very seriously, had universities that do distance learning and really closed the campuses for all intents and purposes. So he liked the fact that we did not hesitate. We took very direct, decisive action early on, and that action we see the benefits of now, I think, in some of the numbers that are being reported. So overall, the concept and what we're doing and how we're doing it is very similar to other states. We're just a little bit earlier at doing it and a little more effective in doing it.
Yeah, yes. Is there going to be any kind of penalty if someone does not go to this website, if someone enters the state, gets the text message, and does not fill out a declaration form? And, do they have to do it every single time they enter the state, even if they're a frequent traveler?
All right, I'll let our Department of Transportation head talk about that, Carlos.
Yes, thank you, Ben, for that question. Allows me to retrieve my mask that I left up here last. Ben, we do not see this as an effort to penalize people. We see this as an effort to inform and to gather data. And we're convinced that when people know what the right thing is to do, they're going to do the right thing because it's going to help them and everybody else around them. And so we will be able to look at compliance because we do know how many vehicles enter the state at all those entry points, and we do know the amount of passengers leaving the airport. So we're going to be able to measure the amount of, I'll use the word compliance, with this executive order, and we could then take subsequent steps if we need to going forward. But I do not anticipate that being a problem. I've found that in Utah, people, when they know the right thing to do, they do the right thing.
Again, Ben, let me just add to that. Again, we expect people to do the right thing, and I think most people will. But we'll have actions that will take place because of the questionnaire being filled out. It might require further interviews, and if they came through the airport, this is going to be kind of an evolution as we evolve to what we really need to do to have best practices in place. It may require quarantine, and we'll make sure that in fact does happen. Certainly if somebody had the virus, we're going to make sure that they're not out spreading it to anybody else, and that'll take some efforts on our part to make sure that people are quarantined appropriately. So, Mayor?
And I'll make one addition to that at Salt Lake City Airport, when we get the capacity to do temperature checks with people, I'm prepared to require as much as is possible for Salt Lake City Mayor that they enter quarantine and that they also fill out the Test Utah form and find out if they need to be tested.
Another question? Chris, are you there?
Yes, I'm here. I apologize, Governor. I was still muted. But a little more, I'm proud to follow up on what Ben asked concerning the I-15 corridor. If someone's coming into the state, it's not an effort to penalize people, but let's say someone says, I'm not going to fill out the form. Someone says, I just want to drive through. what will be the measures taken? And as an additional follow-up, I didn't hear St. George Airport mentioned. You mentioned Salt Lake City Airport. Is St. George Airport going to be a part of this?
Carlos?
So we are not prepared at this point or anticipating that we're going to need to, quote, chase vehicles down that did not fill out the form. So we do not anticipate that as part of this this portion of the plan. St. George Airport, we have measures and we're looking daily at the amount of passengers coming into all the public service airports. In fact, we are looking at all the 46 general aviation airports that we have around the state as well, because there's a lot of private aircraft that come into the state. The numbers are not at a point right now where it would merit that effort, but we are prepared to execute this plan and expand it if we feel the need is there. So today we do not plan on chasing people down that did not fill it out, but we do hope that people will, once they understand why this is important, they will comply.
One more question.
Yeah, hi, Governor. If you look outside at the Capitol complex right now on the lawn, you have dozens of groups, say groups of 5 or 6. They're out there having picnics. They're playing. They're walking on the trails. And you did mention that recreating is fine, but at the same time you mentioned don't do this in groups. And it seems like a lot of people are doing kind of the opposite of what you were asking them to do. When does it get to the point where the state says, you know, we tried to ask you to voluntarily do this, but you're not listening, so therefore we do now have to enforce an actual, stoppage of movement?
That may be a question for Mayor Mendenhall. This is in Salt Lake City, and so that order is in place. We're hopeful that people will use good common sense and good judgment. We're not saying you can't be outdoors. We ask that you keep your social distancing. We've started here a number of weeks ago of saying you shouldn't be in groups of 10 or less. And so we've noticed, in fact, we've talked about that in my office today about people coming out and enjoying the sunshine and the warm spring weather and using our grounds here as a picnic area. We do have a track that goes around that people ought to be walking. We've talked about maybe making that just one-way track so people don't necessarily pass each other too often. But again, we would hope that people will, in fact, follow the directions, the orders that we've given. And if Mayor Mendenhall wants to bring law enforcement up here, you want to speak to that at all? What do we do for those who don't, in fact, follow the order?
We know that not everyone's following the order. It is a 10-person maximum decree, and it does come from Salt Lake County Public Health as our it's a health order, actually, as you know, and it is enforceable by law with a Class B misdemeanor up to a Class A for egregious offenses. To date, I don't believe that anyone has been charged in Salt Lake County, although that opportunity is on the books. And there's efforts to establish a reporting line, which is not 911, thank you, but other methods through Salt Lake County for people to report that. As a longtime air quality advocate, I know that we ask people to do the right thing a lot of the time on reducing emissions and making our air cleaner, and a lot of people try, but not everyone does, and some people do egregiously go the other way. And I think we're seeing that in our public. So I'm grateful that we have the opportunity to do more and know that Salt Lake City, Salt Lake County, and the other 6 counties who have put in a mandate to stay safe and stay home are talking to each other, using daily data and modeling to make the best decisions that we can. And we do have that right to be more stringent. Know that we're looking into that.
That will conclude our press availability. Let me just say thank you to the mayor for being here with us and Carlos for what you're doing. This is a significant step forward. Again, I'll just close where I began. The directives we have in place, the common sense orders that we have as far as directing people how they need to change their behavior, I know it's hard. It's not our nature. It's something our habits have been to get together and socialize. And everybody needs to say, I have a responsibility to be part of the solution and not part of the problem. And so again, maybe we need to nudge our neighbors, make sure that we all comply, make sure that we do our own part to comply. And together we can get through this. Together is the only way we'll get through it. So we implore all the people of Utah, follow the directions that we've given to you on good health, good safety, social distancing, all those things, and we'll get through this together. Thank you very much.
We'll now have the opportunity to hear from Dr. Angela Dunn, Utah State Epidemiologist. Dr. Dunn?
All right, good afternoon. I'm Dr. Angela Dunn, the State Epidemiologist for the Utah Department of Health. So first, our numbers. We have 1,846 cases today. That's up 108 from yesterday. We've tested 36,116 Utahns. That's an increase of 1,469 from yesterday. And we're up to 158 hospitalizations total for the outbreak. So before I open it up for questions, I just want to talk a little bit about the key elements for stopping any infectious disease outbreak, especially a pandemic. The first, of course, is testing. And we've been talking a lot about testing. It's essential that we identify who is infected with COVID-19. And our state has done an incredible job in terms of increasing our capacity to test. We're able to test 5,000 Utahns every day for COVID-19. So those who have symptoms consistent with COVID-19 should get tested. The second piece of stopping an outbreak, especially a pandemic, is social distancing. And you are all doing that. The social distancing directive, the stay home directive by Governor Herbert, in addition to school closures, restaurant and bar limitations, those are all helping to stop this pandemic. And that's evidenced by our slower growth rate and lower hospitalization rate than some of our surrounding neighbors. The third piece is this concept of contact tracing. Contact tracing is a routine but very important part of public health response to any infectious disease outbreak. People who are in close contact with someone infected with COVID-19 not only have a higher risk of becoming infected themselves, but also a higher risk of passing the virus to others. So contact tracing allows public health to closely monitor contacts so that they can get the care they need and also prevent the spread of the virus to others. We are fortunate in Utah that we've been able to maintain this element of the outbreak response, even when many other states have had to limit or even eliminate contact tracing as part of their response. This is because, one, our local health departments have prioritized contact tracing from the beginning of this outbreak. When the local health departments exceeded their capacity to contact trace, the Utah Department of Health staff, both infectious disease staff and non-infectious disease staff, stepped up to the plate and started helping our local health departments with their contact tracing efforts. And recently, the governor requested employees from other state agencies be temporarily reassigned to the Department of Health to support these efforts. And the Department of Health is now training these volunteers to support our local health departments in contact tracing. Treatment is also a very important part of stopping a pandemic. The University of Utah and Intermountain today put out a joint press release describing their combined efforts to identify the efficacy of hydroxychloroquine and azithromycin in the potential treatment of COVID-19. And I applaud these efforts. This is exactly what we need to be doing to solve this pandemic and determine the best treatment way forward. Okay, with that, I'll take questions.
That potentially have symptoms of COVID-19 and stop the spread of that a little bit. And
Hey there, with some of the deaths taking place in nursing home facilities, what is the state's plan for nursing homes? What are some of the components of it? And what advice would you give to loved ones of people who are in nursing homes or other similar types of facilities?
Sure. So we've known from the beginning of this outbreak that our nursing homes, long-term care facilities, are going to be some of our most vulnerable populations. So from the beginning, we've been working with all of the facilities across the state to ensure they understand the best practices in terms of preventing COVID-19 spread or even introduction into their facilities. And so once we've identified COVID-19 cases in these facilities, we work directly with the facility and the local health department to ensure best practices are being in place to prevent further spread. That includes cohorting the patients, or everybody who's been exposed to COVID-19 goes in one area of the building and they're cared for by dedicated staff. So staff that don't care for unexposed patients. In some instances, we have had to transfer unexposed patients to different facilities to ensure that they're protected as well. So this has been going on from the beginning. These plans have been in place, and now they're being enacted when we have identified specific cases within these facilities. In terms of loved ones, I think it's really important to recognize that individuals in these long-term care facilities, the only way they're going to be exposed to COVID-19 is through visitors or through healthcare workers who are ill. So the visitor restriction policies that are in place are there in order to protect their loved ones. And so to be patient and adhere to these restrictions so that every individual living in these long-term care facilities can be as safe as possible.
Great. Thank you, Dr. Dunn. Concerning, to elaborate a little bit on hydroxychloroquine, the trials taking place, obviously there's been some talk that this drug could have adverse effects. And if you can address that a little bit, and also those with malaria and lupus who rely on this drug, how will the access continue for them?
Sure. So whenever we're using a drug for a new disease, there's always potential for adverse side effects. Hydroxychloroquine does have known side effects at high doses that include heart problems. And so that's why it's essential that these are studied in a controlled setting. And that's exactly what the University of Utah and Intermountain are doing. They're studying these in a clinical trial where we can understand the risks and benefits of hydroxychloroquine for treating COVID-19 patients. Hydroxychloroquine is used for other autoimmune diseases such as lupus or rheumatoid arthritis. So it's essential that we ensure that those patients are able to continuously get the drugs they need to treat their diseases and that they don't suffer because they're being used for COVID-19. We have those measures in place here in Utah and are working to ensure that they continue to have access to it.
Hi, Doctor. I have a question in general about some previous incidents that have happened, in pandemic history. So many people have gotten antsy about restrictions the past couple of weeks. We know in 1918 the pandemic came in waves. So I guess what steps are being done once this curve drops to ensure that we don't deal with such multiple waves like in the past?
Yeah, so with novel coronavirus with COVID-19, there is a possibility that we will see waves of this. There's possibility that it's seasonal and that it could resurge in the fall. Those elements we just don't know yet because it's novel, but we are preparing for them. I think it's essential right now that we focus on the current increase of cases and really work hard to decrease that. And we can do that by getting tested if you have symptoms, isolating and quarantine if you've tested positive or have close contact with someone. And of course, social distancing is going to be key to limiting the spread. So my advice is to first, let's focus on this current increase. Let's get it down. Let's start seeing the decrease in cases. In the background, public health is working with partners for that preparation in case we do see cycles or resurgence moving forward. But right now, the public should be really focused on what's happening now and stopping the spread that's going on right now. Sure. So I think the governor's stay-at-home directive, the intent is that everybody will be following it, but it does allow for that flexibility for jurisdictions experiencing kind of different places in the pandemic to be able to enforce the laws that they feel are appropriate for their own jurisdictions. Summit County has done a great job, and they've seen a decrease in cases And a lot of that is due to the great efforts of their local health department. So I applaud them in their efforts and know that the governor is expecting everyone to comply with his directive.
Dr. Dunn, my question is with respect to antibody testing. I believe you briefly touched on it yesterday. What can you tell us about, are there known tests that are being recognized and used right now? If not, how close are we to that? And I believe that there are already private companies that have purchased these, are selling them out into the community. And what do we tell folks that might be spending upwards of $150 on a test like this with the accuracy still being in question?
Yeah, so there are several rapid antibody tests out there, and those consist of a finger prick, and they claim they can tell basically if you've had an antibody response. And what that tells us is that you have been exposed in the past, and then a different measure is determining immunity. Right now, there's not a lot of evidence on the efficacy of these antibody tests. So we're urging caution both by clinicians and the public in terms of interpreting the results. And we have advised various clinicians and businesses on the use of these. The CDC and our own ARUP are working on a serology test that will be more accurate in terms of identifying immunity and past exposure to COVID-19. So we're anticipating those answers to come within the coming weeks, if not sooner. So my recommendation would be to wait for the scientists to come out with more conclusive evidence before we're able to draw a conclusion on any of these tests.
Hi, I had another quick question about nursing homes. We saw one facility go to entirely COVID patients. Is that something that could continue in the future? Additional facilities changing that way, or?
Yeah, and that was part of our planning with long-term care facilities, is planning for the potential of needing COVID-19 only facilities to ensure that spread is as limited as possible to other residents. So this facility that is now COVID-19 is doing a great job in providing a service by treating those who need it with COVID-19 while providing them long-term care as well. Right now, we don't have a need for another facility to do that, but we have partners that are always in conversations about this and ready to stand up other facilities if needed.
Yes, Dr. Dunn, I wanted to know just what the latest modeling is showing as far as when we could peak, when we could see declines in cases, where we are on flattening the curve.
Sure. So there are a lot of models out there, and we as epidemiologists and public health practitioners really shy away from really focusing on any one individual model, because when you have a novel pandemic, we can't accurately predict how it's going to act. That's part of it being a novel virus. There are models that show, the one out of Washington that's online for everyone, show it peaking this month. We have our own internal models that show it peaking later this summer. So we're just preparing for stopping the spread that we're seeing now and ensuring that we see a significant decrease in cases, and then moving our strategy forward from there. Okay, thank you so much.
That will conclude today's briefing. We look forward to seeing you again here tomorrow. Let me just say one note. I've received several questions about my role here. Again, my name is Paul Edwards, and some of the press is aware that several months ago, I took an appointment at Brigham Young University as director of the Wheatley Institution at Brigham Young University. At the urging of the governor, I've taken a personal leave of absence from Brigham Young University, and I'm working here on his behalf with the efforts to deal with the significant issues that are coming forward. And so any of my representation has nothing to do with the Wheatley Institution or Brigham Young University. It represents the governor of the state of Utah. Again, thank you so much for your participation in these daily briefings. We look forward to seeing you tomorrow.